Good evening, everyone. First of all, I have to thank Jin Ramesh sir for giving me such a difficult topic. Um, how to balance? How many of you feel that you have a balanced life or a bank balance? You have a balanced life actually. How many of you feel that you have a balanced life? Wow, I didn't expect that. How many of you are trying to balance? Wow, right, impossible. That's something actually technically we really see when you go deep into it. Something mission impossible actually. But the reason is you don't have to actually keep it balanced. Why should we keep it balanced? Let it go as it goes, right? So, but it's something very important. Actually, we keep trying to balance. Keeping it balanced, I don't know how many of us do really keep it balanced, but keep trying to balance is something what we really need to do. When we take our life or when you take it to someone, everyone is bothered or judge you technically with your work and family, right? If you have a good work, you have a good career, you have a good family, that means that you're doing perfect. You have a balanced life. Actually, no. We always forget about our health, forget about our time, forget our personal things, which is most important thing, which is almost more than 50% of the thing. And really, that is what actually is going to keep you balanced, help you balance. On going through, I have seen a lot of papers. The prevalence of having an imbalanced lifestyle or an imbalanced family and a work conflict basically is almost 70%, 60 to 70% in India. Whereas when you compare that with other countries like Europe or US, they have a lesser percentage. More many of them are happy with their balance, basically. But in India, it's very high. And there are a lot of studies saying that it's almost practically many of them have given by the age when they keep going elder and when they keep going, they almost forget balancing it. What are the effects of having a poor work life balance? First, most important thing, depression. But we doctors are very blessed because we don't show our depression. We know how to cover our depression. I don't know how we develop that in our practice. That is one most important thing is like because our patients. When you go to an ICU, no, have you seen that? We have five patients. Let us take example. We have five patients in ICU, right? So the first patient is having a malignancy, and we have operated, doing good, and he's recovering. We are planning to shift him to the room. Now the second patient is died, right? So the patient is having some road traffic accidents, severe head injury with severe liver lacerations, and probably he may go pass away in another 6 7 hours. So say like the next patient is not doing well, we did a surgery, having some surgical complications. So patient is really on a deteriorating stage. So we have different kinds of patients. Now, when we talk to the bystanders, after the rounds, we sit and talk to the bystanders, briefing time. So what we do when we see the first patient who is very happy because the surgery is done well, patient is recovered well, you're shifting the patient. So you're very happy, you tell them, everything went on well, we are going to shift. And patient is very happy, the bystanders are very happy, they keep talking to you. But once that patient goes, the next patient comes, patient is going to die. Now you immediately change your mind. Your feelings completely is changed, and that is not a fake one too. You really are worried about that patient. So this mood swings is one of the most important reason for technically depression, which we do not understand, and of course the work and other reasons also are there, and burnout and fatigue. We in India, our workload is so high that we easily get burnout and fatigue. And this reciprocates to, family life, where when we go to another place expecting some kind of relief, we may not get it. So that is another reason. Conflicts in work, family, anxiety, the poor relationship, stress, and poor stakeholder management, and lack of self confidence. So, these are all one of the most important outcomes or effects of having a poor work life balance. So, when you take work life balance, many of us, we always think about family, we always think about work. So, if these two are balanced, then everything is okay. No, absolutely no. Because The work-life balance is not only about family or only about your work. It has lots of other things. It has about your health, it about your, vacations you are spending, the money you have, how do you spend your time. So all the things really matters. It's not just about two important things. It's not about if you take family does not mean that if you're doing a household work. My wife keeps on complaining me. I'm not doing many household work. I'm not going for the grocery shoppings. I'm not doing that. I'm not doing this. That is not work. That is not a balance. If you do that, does not mean that you are balancing it. So, how to get to this balance is really a big struggle, right? As a physicians, we know we have lot of stress and lot of things to handle. And when you come to, I'm really sorry that there was another monster picture along with this. Sorry, ladies, it's not. So basically, when it comes to family, there are a lot of issues. These issues are some things which you cannot avoid. You don't have to avoid. Fight in family is absolutely all right. You have to have it. If you don't have it, then there's a big problem. You're not doing it right. Right? Work. If you're not having complications, we always say that when with seniors when we talk, you're doing surgery. How many tests you're doing? Sir, no, I'm operating some 100, 200 cases. Okay, then. How many complications do you have? No, I'm not having any complications. That means that you're technically means that you're not operating or you're not doing enough cases. Right? So having complications, having problems is absolutely fine and it's needed. And the balance is not actually about that. Balance is not something what you find. Technically, balance is something you create. Okay. So, what is important? Create a good work and family balance. This stone in the middle, something more important. It is technically you, right? It is you who have to balance your life first. Without balancing your life, there is no way you can balance your work. There's no way you can balance your life. If you see people who are having a balanced life or who are trying to balance themselves, they first correct themselves. They try to correct them. And it does not include only to the person you, it means that it person to the other person in the family also. So if I'm correcting in my family, it means that my wife is also doing the same thing to correct it. So unless we do that, unless you correct yourself, right? It is not going to get balanced. You are the most important thing in the world. So take care of yourself and balance yourself first. So to balance yourself, I'm going to tell two things that many of us do forget it, right? It's never late to change. That is one of the most important things. It's never late to change. You need to change at any time. You feel that you are not having a balanced life. That is the moment you need to change yourself. Rediscover yourself. For that, the most important thing first you need to do is have a me time. The me time, how many of us have a me time? Very good. So, what do you do in the me time? Eat. So, the me time, see, basically, me time it does not mean sitting and watching TV or taking a bottle of alcohol and drinking it and spending time coolly lying down on the sofa. No, that is not a me time. Me time is discovering yourself, doing something productive for your own health, for own that is mental and physical. That is most important thing. You really each and every one of us should have a meal time. The advantages of meal time, it reboots your brain, it keeps yourself very sharp, helps you to unwind your problems, improves your concentration, makes us more productive, gives space for self discovery, allows time for deep thinking, aids in problem solving, enhances our relationship. This is one of the most time because when I had an imbalance, I had my imbalance in my family or work, whatever it is. And when I got into this concept of me time, half of my problem is solved. And when I talk to others about people who are having meal time, they are really having a good balanced life. That is because once you define yourself, half of the problem, because I understand that imbalance is not because of your family, imbalance is not because of your work. Technically, imbalance is because of you. you're not managing it properly. You're not able to manage it properly. You're not able to find a solution to how to manage it properly. That is one of the main reasons, probably leading on to an imbalance. So the me time matters. It may be going to a gym, going for a cycling, or going for photography, or writing books. And reading books. And reading books is not. I'm writing books or doing something productive, basically. Another most important thing, how many of us learn to say no? Dr. Rajiv Devan, I really, he is one person where I used to see him. Very nice. He knows when to say yes, when to say no, how to manage time, and all these things. How many of us learn to say no? It's very difficult for us to very difficult for us to learn say no. But it's very important that we have to learn to say no when and where. That is important. You can't just keep saying no to every place. Of course, sometimes leads to serious complications or problems. But this is one of the most important things because it sets boundaries. It will save your time, energy, and freedom, helps you to practice self care, makes room for important things. When I was doing my post graduations, I was a workaholic. Basically, I'm a big workaholic. So, most of the time, my advice from many of them were like, you're putting too much of effort on work, you want to operate, you want to do that, you want to do this. Like, I never had the courage to say no. I always ask person. Anybody asks for anything, I think, yes. You want to do extra duty? Yes. Okay, no problem, I'll do. But this indirectly was leading me to a lot of issues which I was not recognizing. You will not, as doctors, we are not able to find that. That's the main problem because we are very comfortable with saying yes and we don't want to say no. So saying no is another most important. These two important things, the me time and saying no is something very important and we should learn it and we should and should not feel bad to say no when really things matters. Now, practice of family is like there is no way actually for me to tell how to tell that family is important and no both are important technically. You cannot actually say that uh, concentrate more on family, concentrate more on me. But there is a time period where you need to prioritize for certain things, right? At the any age, technically, you need to put more effort on your career basis so that you develop your career, so you get into a career. Your family also wants that technically. So your family does not want you to sit home and keep saying, my wife, my wife, my wife. No, she doesn't expect that, right? She wants you to go where work well, to become a successful person. She appreciates that. But what's the problem there? I'll come back to you. So, there is like age factors where you need to prioritize certain things. But ultimately, you need to, of course, spend enough time to keep that balance. That does not mean that do your full work on, do in young age, always keep working. No, it's not that. But prioritizing, you can prioritize as per the age. The next most important thing we lack or we most important thing we don't do is time management. So this time management is one of the most important things. For me, the most important success, I'm making films, I'm doing short films, I'm doing a lot of sports activities, I'm into photography, and I do a lot of surgeries, and I'm the only gastrosurgeon in the hospitals, and I do take care of my family well. It's all not because of some, I know I do just, everybody is just falling into the place. No, it doesn't fall into that place. I steal time. I try to sit and work on the time. By morning, I get up. I know what time I should get up. I sit and work and see where to spend the time, how to steal the time or take time for me, my family, my passions or your work. So time management is most important thing because it helps you to set clear goals, prioritize tasks, learn to say no, and plan effectively, avoid multitasking, and eliminate time wasters. So basically, when it comes to time management, this technically I was almost following this for some quite time. We all have one day, 24 hours. So we don't take 24 hours is quite long actually. So we divide this into three. So I call this the 8 plus 8 plus 8 rule. So you have 8 hours for work, 8 hours good sleep. And what I do is 8 hours having good sleep is really difficult. 8 hours going to sleep, 10 o'clock you're going to bed, and 6 o'clock you want to think you can't sleep for 8 hours. So I steal a couple of hours, an hour or a couple of hours for my sleep. So 6 to 7 hours is my sleep time. So you steal 1 hour or 1.5 hours or 2 hours for you. And remaining 8 hours is technically for your family or your friends or whatever, all the other things. So when you keep this and follow this, see, basically if all of us work from 9 to 5. But as we doctors, our priority or our working hours is in India, technically. I don't know when we are going to learn from other countries to have a time limit of work. That is really very, very important. What we are following is absolutely not right or absolutely not needed actually, but we need to frame this time limit and work on it. So if you truly ask me if it is work or family, um, concentrate more on yourself first. That is the most important thing. Prioritize, give importance, find out the problems and all these things. Forget it. It all comes and goes. You need to sit and talk and think. Ultimately, the problem is the time. You need to do a proper time management. And if you strictly ask me whether you need to practice or you need to work on your work, you need to prioritize your work or you need to prioritize your family, I would somehow little bit move towards my family because work. I'll always tell many of my patients, whenever we see patients, doctor, I have my time, I cannot do that. I have hemorrhoids, I'm sitting for a long time, or I don't have time for food proper, so I have gastritis. So always I tell them this one example. See, for example, I'll put an example with me. I'm a single gastrosurgeon. So now I'm working like anything, right? I'm doing everything and happy, management is happy, the department is going good, patients are happy. Now, because of my work and stress and whatever it is, if I develop certain problem, a health issue, where I am not able to continue my work, the next second you're replaced. A better gastrosurgeon will come and sit there. A better person will come and sit there and manage your patient better, talk to them better. But remember, that is not on your family side. You cannot be replaced on your family side. You need to take care of your family. There is no prior, there is no way you can avoid. Have them with you always. Talk to them, make them understand. They understand. They don't want you to be always with them. They only want some time. Your husband or your wife or your kids, they all need some time. They are not worried whether you're doing a housework or you're cleaning the garden or no, they are not doing that. They know what you are. You're a doctor. They all expect is some time. Give that time. Manage yourself well. Automatically, everything will fall in place. Thank you.